So what we're going to be talking about is what we mentioned on our last post, were the three main sources of dystocia, or difficult or long or painful labor. We just happened to have a pregnant patient walk in and she volunteered. So we're going to go ahead and talk through this. The first thing that we do when a pregnant patient walks in is we feel the spine. The first thing that I notice usually is the positioning of the sacrum. Now, if the sacrum is tilted left or right, doesn't matter which direction, what that's going to do is going to make the pelvis overall less adaptable. When the pelvis is less adaptable, that's going to change the shape and the diameter of the birth canal, making it potentially more difficult for the baby to come through. Second thing, when the sacrum is tilted, let's say hers is tilted towards the left-hand side, that's going to cause extra pull on the round ligament on the opposite side. This causes uterine torsion on the inside, which leaves less room for the baby to move around, and it's commonly why babies would get stuck in a breech position, transverse, or sunny side up, therefore also making labor and delivery much more difficult. Finally, when the sacrum isn't moving the way it's supposed to, it's supposed to act as a structural foundation for the whole rest of the spine. So if this isn't moving well, the low back is going to have to work harder, which means that the nerves coming from the low back are going to be stressed out. These nerves go to the digestive system, obviously the back muscles, but they also go to the reproductive system, including the uterus. Okay? The uterus is a muscle which requires information from the brain to know when to contract and how hard. So if the low back is stressed out, that means the uterus isn't going to be getting all the information it needs, or the brain isn't going to know exactly what the uterus is doing, and that's when you can get contractions that start and then go away, or contractions that are weak and don't really do work to dilate, or finally, contractions that aren't on rhythm, and so you never really progress. And so that could be one of the reasons for failure to progress, which usually leads to the Pitocin, and then leads to the epidural, and then what I've commonly seen too, go 24 hours and then they're going to do a C-section because there's failure to progress. So this is why we really love pregnant ladies to be under chiropractic care, so that way we can make sure that all these things are moving the way they're supposed to. It gives you the best chance to have a stress-free pregnancy, labor and delivery, pain-free-ish labor and delivery, but then also helps the whole entire body be as calm as possible.